We are going to be doing something new. We're going to call it a buyout debriefing. And there is so much happening during the buyouts, and we are focused on the horses. And we don't always have all the information that you all want immediately. And when we go through these really big buyout rescue missions, we are intercepting horses that are en route to go to slaughter, or some of them have been en route and they actually come back to us. They've already gone through Tennessee or something, and they're coming from basically the border. And what's happening is on back hauls, there are animals that basically are taken to the border, from what I'm assuming is happening. And then they have an empty trailer. And if there are horses or donkeys that wouldn't bring as much in the slaughterhouses, they're filling the trailers up on the back hauls. We're still intercepting these animals. It's wild and it's crazy, and there's no other organization out there doing what we're doing. But getting the information out quickly is challenging, because I know even at the end of the day, they're like, well, how many were euthanized? Many times we don't know, because we have euthanasia technicians that are here euthanizing. Sometimes the vet will have to jump in and euthanize really critical cases. Like it is like being on the front lines of a war when these trailers come. And we thought maybe a debriefing would be the best way of kind of being able to talk about the different horses. Like right when they come, they don't even have names, so they're a number, which seems like, it's just a number, but that is where we're at right now. Like we have our fans naming them, because thankfully they volunteered to do that, because otherwise we'd have to come up with a lot of names, and I don't think we could do all of that. So we'd love your feedback on this debriefing. If you like it, if you'd like to have more of it, like we just try to do things to get information out there. And I think this would be the easiest way for us to sit down in like a 15-minute time of this is what happened. So we had 21 horses and donkeys, and a mule came in yesterday. And I'm going to turn it over to Dr. Lydia and Dr. Gina. I know very emotional. These first days of the buyout are just so incredibly emotional for us all as rescuers. And if you're in our members video today, walking down from quarantine, I was talking about these donkeys that are it's heartbreaking. And I started crying during the video, because like we give it our all for these animals when they come, and it's extremely challenging. We try to focus on all the positives in our brain. And so that's where when people are like, well, what happened, and how many horses were euthanized? And I just really love to be able to share like this video and be like, watch the debriefing. That way we can address it, we can talk about it, and then for our mental health, we can move on and focus on the positives. So we're going to dive into this. Dr. Lydia has a mic on because she loves to talk.
I'm the chatty one.
And Dr. Gina and I are going to share this mic because our filmers are out there with the other mics filming with them. So we're just jumping in to do this while we have a little bit of time. So I know you all are very good about documenting all of these horses, and you see them all. So kind of take it from the veterinarian perspective of what buyouts are like, and then we'll dive into the actual animals.
So as a veterinarian, it is heartbreaking, and you have to guard your heart a lot, because you have to keep on focus and your mental acuity to try and provide as much medical attention to all these animals as possible, because if you break down on one, then you're just kind of like, you want your ER doctor to be on point. So that's what we're trying to do with these animals. We're trying to give them our best medical attention, even though at the end of the day you reevaluate, did I do enough? Did I think this through enough? You always question yourself, but I think every good doctor would do that, because we want to do the best for all these animals that we can. And it is very heartbreaking when you see the state of some of these animals, and there's nothing you can do in your capacity to fix them. So, but we do have a lot of positives. We have a lot of encouraging cases and a lot of wins, so that keeps us going. It fills our heart, makes us happy.
We talk a lot about the Awkward Yeti heart and brain cartoons. I know Dr. Gina looks at those. You kind of have to divorce your heart and your brain, which is really difficult, because often it comes down to a heart decision, but you can't get there until you have the objective information. And that's where I love working for Horse Plus, and I don't think I could do this job if we didn't have diagnostic resources. So being able to do in-house blood work, being able to do consults with professionals, taking radiographs, having that black and white information that your brain needs gives you those puzzle pieces that then ultimately your heart has to make that final call. And we kind of had this intake day sprung on us last minute.
Very
normally
last minute,
take like
yes.
3 days to gear up for intake days because I'm a crier and I immediately love everything. And if I start crying on one case, I'm kind of and so if you watch us, Dr. Gina and I guard each other well and give each other breaks. And sometimes you'll see one of us step away because you just sometimes have to take a minute and refresh. In a veterinary clinic context, there's that actual leaving of the room and entering a next room. And so any veterinarian that goes from a first puppy visit to euthanizing an 18-year-old dog to a first kitten visit, we have this massive oscillation of our feelings. And on our buyout days, I'm an optimist. There's always this there's the Doras, there's the cases that you're like, this animal went from almost being dead and septic to going to an adoptive home. And that's why we do this job, because those stories are so buoyant and uplifting. But unfortunately, there are way more cases where there are animals that should have received humane euthanasia, sometimes years prior, and people just aren't willing to make those hard calls. And so not only are you being put in a position where you're physically performing euthanasia, but you're also being put in a position where you have an animal that's been loved and cared for and then abandoned. And so you're giving the last cookies in the last minute, and you're being that person for that animal in end of life. And I don't ever skimp on that, but it's a tough job.
It is incredibly challenging. And, we used to rescue 20 horses a month from the auction. We're like, woo! We're rescuing 40 horses easily a month. 77 at last month's buyout, and then 21 yesterday. More coming in on Monday. Thankfully, we have an amazing donor that's donating to help really revamp our quarantine facility to expand that, which will really help. But thousands of horses are being exported for slaughter, and 300 a week. Most USDA slaughter export reports about 300 horses a week are exported into Mexico. And what we're doing here is a drop in the bucket. But for those horses, it's changing their world. And what Dr. Lydia was saying about these horses have gone for years in chronic suffering. I get upset and angry because somebody allowed this to happen. And so I think just from an emotional standpoint, buyouts are so incredibly hard. And, it's great having the diagnostic equipment because we can look at the x-ray and be like, yes, this is the right decision. And I know some people are like, that of the 77, there were 44 that needed euthanasia, but these animals need it. And if people are like, oh, why were so many euthanized? We have 2 amazing veterinarians here. We have diagnostic equipment, and I don't care if we rescued 100 horses that were all suffering and they all needed euthanasia, and then that was the right thing to do. And that's the challenging part of this, is intercepting animals out of the slaughter pipeline. These animals are doomed to a horrific, painful, very traumatic death, and we're able to bring them here. And those Dora stories, that's what pulls us through. But yeah, so we could talk all day and bore you to death, I'm sure, about this. But let's jump into the ones that we just got, the 21, and kind of step you through what happened. Now we're going off of numbers, but that's what we have right now. So we can't really put up the pictures and their names. These are our internal numbers for the buyout, and I think it was 316 was the last one we ended on, I think.
Oh yeah, we don't have the
yes, so and that's 316 horses through the buyout program this year intercepted. So that's like an entire week of horses being sent to Mexico that we've already intercepted this year. which is huge. So, yeah, we'll jump into this and see how this goes. Again, please give us your feedback. Let us know what you think about this debriefing and if you'd like to see more.
Our first guy is unfortunately just B numbers, but B24296, and he was the little jack donkey that was limping when he got off the trailer that we thought possibly got kicked or something on the trip up here. And we took radiographs of his shoulder, which Dr. Liddy had some great tricks to get good shots of his shoulder. And we didn't see anything but soft tissue, but then we looked in his mouth to age him and saw that he had dental pathology. He also had halitosis, or a foul smell to his breath. So we took dental radiographs, and then we saw a really, when you were describing radiographs on bone, it's like a moth-eaten appearance where there's holes in the bone, and that was really disturbing to see because unfortunately that is not a good prognosis, and he was an older gentleman. We gauged him at about 11 years old. So we were worried about osteomyelitis versus osteosarcoma, but osteosarcoma is more in the limbs, but it's possible.
Yeah, whether you have infection deep in your bone or cancer deep in your bone, on most parts of the body, you can have a pathologic fracture. So even if you target the primary cause, you usually end up with a catastrophic fracture. And this donkey already had a very painful mouth. And we were hopeful that we could pull him through with his shoulder injury, which was also severe. He was almost non-weight-bearing lame. But we recommended the last act of kindness. His prognosis was very poor.
And then didn't he have the breathing issue too, we noticed?
Yeah, he also had an elevated respiratory rate.
So unfortunately, the last act of kindness was decided unanimously on him just for his quality of life.
And we might not mention this, but anytime we have any animal with an elevated respiratory rate or discomfort, they immediately get pain medications. This guy got great pain meds. He hung out in a stall with some grainies and some hay and some water. So we don't always talk about that, but we don't let animals suffer while we're waiting for diagnostics ever. As soon as we can safely handle those animals, we intervene medically.
And some of these horses are coming in and donkeys, and they're in so much pain, they're just gritting their teeth. And it's one of the best gifts we can give an animal when we know there's nothing else we can do, is to give them that pain medicine.
Yeah.
And for the first time in maybe years, they actually get to experience a pain-free time. And you see them go over and start eating, and they relax. And it's like, even if that was just the only gift that we were able to give them, just to give them that time in that stall with that food and that water and that comfort of being like, I feel good for once in who knows how long. So that is for me one of those things I hold fast. I'm like, oh, they gave him pain medicine and he gets to go in that stall and be comfortable for once. So yeah, all these little things that we have to hold dear to our hearts to make it through.
So this is our Haflinger boy. Do you want to talk about him?
Sure. This gelding definitely stood out in this group. We had two that looked like they were Haflinger crosses. This guy was, I aged him to be 35 based on his teeth. He could have been older. His body condition score was pretty low at 2, and I always walk over with a treat bag to kind of see who's interested, and he was like, make way, everyone. I know what the treat bag is. So somebody definitely loved this gelding at some point. He had a pretty severe malodor coming from his mouth, and what happens with horses, they're brachydont, so their teeth grow continuously over life, and as they age, that rate of growth doesn't keep up with their rate of wear, and so he had some severe dental pain, and I actually wasn't able to even open his mouth because his jaw was so painful. We did take radiographs, and I believe that he also had some temporomandibular joint, TMJ, if you get pain up here. But he also had some discomfort on his legs, and so Dr. Gina took some radiographs, and he had a very severe, also moth-eaten pattern that affected multiple joints in his distal limb that could have been consistent with osteosarcoma. I've actually never definitively diagnosed osteosarcoma in a horse. It does happen. We see it more often in large breed dogs, but it was that same moth-eaten appearance. He was at an elevated risk of a pathologic fracture, and he was painful. So we also recommended last act of kindness. He also got a lot of cookies.
He got a lot of cookies.
Meds.
Cookies, pain meds. I think he was an Amish horse, and they had been using him because like his forelock and everything was shaved down.
Yeah.
And that's from them putting the harnesses on and off. So basically, he was used into his 30s as a workhorse, and his lameness probably got finally so bad that they're like, get rid of him. And, you know, these are the type of horses that we're intercepting and rescuing. He shouldn't have gone to slaughter. Like, that's what we intercepted him from. He deserved to come here and get lots of cookies and pain meds and enjoy life.
Oh, this is the Tennessee Walker mare. About B24 298. She's about 19 years old. She's a beautiful big black girl. She does have a cut tail tendon, doesn't she?
Mm-hmm.
So she was probably big lick at one point. She's beautiful. She needs a dental. We gave her all the things. She does have ring bone.
What are all the things?
So she got a microchip, she got Coggins, rabies, 5-way, strangles, which goes up the nose, and she was dewormed with ivermectin. Those were all the things.
Yeah, so in our episodes, when you're like, give her all the things, those are all the things. And those things are expensive. So
Really expensive.
vaccines are very,
yeah, so definitely
expensive.
donations are definitely needed to these. Because when we're like, let's do all the things, that's putting a lot of money into this animal for all the things, to give them the best chance they can.
Yes, so we're hopeful for her. We did take radiographs of her left front, and she does have some pretty significant ring bone going on. So we need to do a lameness exam on her at a later date and a sedated dental. So hopefully all those things will work out and she can gain weight and be happy and find her forever home.
If we have 77 horses in a future debriefing, this might take all day. But
I know you said 20 minutes, and I was
well,
we'll do our best.
We'll do it. We'll do what we can. With these Tennessee walking horses, we know that they are performance horses doing the big lick because that tail tendon is cut. And when we're doing these initial intakes, we are saying, let's give them all the things in hopes that they will be okay. And these are horses that are stable enough to go out like the 10-acre pasture and relax and be happy and calm. We don't know what their full outcome is going to be for a long time, because there's multiple rechecks and reevaluations and things that happen up in quarantine. And then when they come down for the riding evaluations, like we might find out that they're, we didn't know it up in quarantine, but their back is extremely painful. Like, we're trying to do everything we can to be as thorough as possible, but we really don't know the full outcome until we're able to actually do that full evaluation that takes over 30 days to do.
Yeah, a full lameness exam takes 45 minutes to an hour to do appropriately. And when you have as many animals come in, you're looking at like a couple steps and trying to do the best you can. And I think Tawnee's description of a field hospital, it's truly a triage situation. And then so many of these animals are like over 20, some of them are over 30, and we always want to give them a chance. But we also, we don't want to give up too early, but we also don't want to prolong suffering. So it's always a really difficult day, because it's like drinking from a fire hose, trying to make those right calls on every animal. We miss a lot on intake days that we then find later on when we have more time to look at each animal.
Especially when we have a lot of criticals come through. So we definitely need to make them our priority. And then sometimes at the end of the day, we're like, everyone's eating, drinking, walking, no one looks painful.
Yeah.
Let's give them the things, put them out in the 20-acre or 10-acre, let them decompress, and then recheck them. And then that's usually when they show up with other things once their adrenaline has gone down.
This gelding, B24 299, we said was about 19 years old. And he had a very low body condition score and evidence of chronic diarrhea. He had fecal staining kind of on his tail and his back legs. He had hypermotility in all 4 quadrants of his GI tract. So when we listen to the GI tract moving, we have normal gurgles, and we have slower than normal gurgles and faster than normal gurgles. So there's some kind of systemic gastrointestinal problem that's causing hypermotility. There's a lot of different things that could cause that. But otherwise, he seemed stable. He wasn't clinically dehydrated. We did take dental radiographs, and he has a very severe wave mouth. So normally the occlusal surfaces should be like this. And in this horse's case, we had kind of like this situation going on. So we can reduce this part, and you still have the corresponding abnormality. But if you have enough of an occlusal surface still, we're hopeful that this horse will gain weight. He's a great example of an intake horse that definitely has a chance, but he also definitely could have some major catastrophic organ dysfunction. I believe we ran blood work on him that we don't have in front of us at the moment, but he also got turned out. He got probiotics and electrolytes in addition to the other things that we did to try to help address whatever was going on in his GI tract, but there's a lot of things that it could be, and he could continue to have diarrhea, so we'll continue to keep an eye on him.
I just pulled up the our communication for animals, so I'm like, see the
Looking at
photos
them?
of
Yeah.
which, that's helpful. But you all don't have the photos of them, and maybe down the road with the debriefing, we can have a TV screen behind us, and we'll pull up and have the photos and stuff. But this is just a first run for a debriefing. And again, please give us your feedback if you want us to continue these, because it does take a lot of time away from these wonderful ladies where they are usually helping with animals. But we do fully understand that our donors are the ones that make these rescue missions possible. And so your feedback is really critical, especially if you've made a donation to like the buyout rescue missions or whatnot. We'd love to hear your feedback if you want to continue to have these.
So the next one is B24300. He's the 20-year-old quarter horse sorrel gelding that was so severely dehydrated that Dr. Lydia gave him emergency rectal fluids. We need to do a cardiovascular recheck because we thought we heard a murmur, a 2 out of 6 heart murmur on him. We grade heart murmurs from 0 to 6. And he also had mildly elevated lung sound, so he's kind of one that we really need to keep in the forefront of our mind on rechecking these guys. But he did get to go out in the 10-acre.
He's really skinny.
He is really skinny, and he also has some leg wounds, but they're very superficial. But he's one that we definitely need to keep an eye on. But he did get his microchip. He got his rabies, 5-way, strangles, ivermectin, and his rectal fluids.
Got all the things.
So he got all the things,
including blood work. We don't have our blood work included in here, but
yeah, we don't have it on our attached to our sheets.
But maybe in future ones we will.
Yeah.
We had another large Tennessee Walker come in. This gelding I aged around 28, so senior citizen, very low body condition score. This guy was black, and he had a big scar versus hair loss over the center of his forehead, kind of extending over his right eye. He was very, very sweet and halter broken, and he definitely needs a sedated dental. His heart and lungs sounded okay, other than being very, very thin. We didn't identify any other overt health concerns, so he also was turned out. Dr. Gina and I age is just a number, right? It's not a disease, and so we don't ever want to make age-based decisions. We want to make decisions based on clinical health, because you guys have heard me say this before. Sometimes a much older horse is a great fit for a very young child, even though it's hard to adopt an animal knowing that that animal has a very limited lifespan. Some of these geriatric animals can be incredible assets in our lives, and they have a lot of wisdom, and they're safe. But what's hard for us about these older animals is that we try our best to fix them in our 30-day quarantine period, often much longer than that. But if we have an animal come in that's emaciated and we fix all of their teeth problems and all of their things and heavily refeed them, and they gain no weight or they lose weight, then we have to make a call on these animals. And they're animals we've been caring for months sometimes, and that's really hard. And those are often the stories that I think get missed, and people go, well, what happened to that horse? And it's like, when you try everything, sometimes that age does end up being, sometimes it is as simple as there aren't enough teeth to sustain, or the metabolism isn't keeping up and gaining weight. And those horses don't deserve to be indefinitely kept around as walking skeletons. But this, I'm really hopeful with this guy, but he is 28, so hopefully we can fix his teeth.
And time will tell, but that's the beauty of having these ladies here as full-time veterinarians at our shelters. We're able to do this and work with these animals. And, from the aspect of years ago, and as the organization grows, it's amazing, but years ago, we were only able to basically have a vet out during the intake, and it was very brief, and we were finding issues. I know there was a pony that got adopted out to a young man that we totally missed, had this huge, massive heart murmur. And he absolutely loved this pony, and that heart murmur ended up the pony lost a ton of weight because of the heart murmur, and ultimately he had to have his pony euthanized. And it was just the saddest story, because I'm like, if we had more vet presence, we could have caught that and not adopted out an animal that was in organ failure. And these are the things that are hard, but as the organization grows, and thanks to all your support, we're able to catch things that ultimately are pending for these horses. And I know some horses have come in before, and they look great when they come, and they're being surrendered because they have cancer. And then we're like, well, let's see what we can do. And we see that the horse is losing weight. And I know that there's one horse, the one I'm talking about, is on the haters are like, took pictures like, look, he's losing weight, but he had cancer. The owner knew he had cancer. It was a rapidly developing cancer, and brought him for us, like, you can euthanize him or you can figure it out. And we're like, well, let's see. And we did the research, and ultimately he needed euthanasia. But that's what shelter medicine is, and sheltering is, we try our best with every animal. And that horse is 20 years old, but who knows? If he's okay, he can go on to be a great kid's horse. And if he's not, we're here for him. We're here for horses regardless of what happens and what they need.
That's very true. And that's a very important point of this work.
Yeah.
Is that I know a lot of people see the tragic cases that we have and the ultimate sacrifice that these animals have to give for these people that have surrendered them into this situation. And we're just doing the best we can for them. We're advocating for them.
Yeah.
And sometimes letting them go peacefully with dignity is the best thing we can do before they get to a point where anybody could be like, oh yeah, that animal needs that.
I think, not to get too sidetracked, I'm an in the weeds person, but something that doesn't get talked about often is how critically important history is.
Yes.
And ask any healthcare provider in any field, an accurate history is the backbone of your entire approach to a patient. And I would say 99.9% of the time we have zero history. So that case that Tawnee's talking about, we don't know. We would love to know why Dora had a trach in place. And, we would love to know horses that come with giant scars. Was that a mass removal? Was it an accident? Knowing what happened in a vet clinic context, you have an owner coming in and saying, this is the date that it happened. These are the signs that we've seen. This is how my dog is acting. And here at Horse Plus, we get none of that. And so we're doing the best that we can with no history. And we miss a lot of things because a lot of the things that we base our diagnostics and our list of differentials on are based on that history. And the tests that we pick are based on the history. So it's a tough job. And we always beat ourselves up when we can't immediately find something. And sometimes we have horses that look to be in great shape. And Dr. Gina, yesterday we were driving down and we're like, what's wrong with you? Because we get animals that no one else wants for a reason. We so rarely get any animal that's healthy. So
and that's true. And these horses that we're getting is everyone walked away from them. Like, they have no advocate. They have nobody who cares about them. The only person that cares is how much money they're going to get off of them in the slaughterhouse. And, we get zero history on that. And, it's a very challenging thing. They might be down here getting evaluated for adoption, everything, and we're still figuring out what is going on with this horse medically. Obviously a lot happens on that first day, but it's a step-by-step thing as we go along here. But and remember, give us your feedback. We want tons of comments on this video so we can know if this is worth doing again.
The next one is B24302. He's a 6-year-old Jack donkey that was very overweight. He was a 9 out of 9.
He was an 11 out of 9.
Yeah. He broke the scale on the 9s, but he unfortunately had elevated respiratory efforts, and so when Dr. Lydia listened to him, he had what we're just going to call it the donkey respiratory disease sounds. So he had those sounds that were consistent with what we've been seeing with donkeys, unfortunately. Have these conditions that cause them to decompensate really quickly, really rapidly, respiratory-wise and cardiovascular-wise. So we were worried initially that he had metabolic disease because he was so overweight, and he had club hooves in his right front and a slipper hoof in his left front, which means it's chronically that way over time. And he also had mucopurulent nasal discharge, so he had a lot of things going on, and he probably would have had more if we had done CBC Chem and tried to keep him around, but unfortunately he already had an advanced stage of that donkey respiratory disease.
I can hop in really quickly. So I've worked part-time for Horse Plus for 9 years. And Dr. Scott, Doc, who was here, he actually consulted on a lot of these cases, because we would look at cases and be like, well, I don't know what to do with this. So I've actually seen, I don't know how many, but a very frequent occurrence of donkeys coming in, some of whom already look sick, some of whom look okay and then develop symptoms within 12 to 24 hours. And respiratory distress is a true emergency. I'm not an asthmatic, but breathing is essential to life. And if you can't oxygenate, you die. And it's not a good way to go. So unfortunately, we had 2 donkeys in our last group. Thankfully, most of the rest of the donkeys that came in with the large buyout look okay, although one developed symptoms over the past week and we had to let him go. So Dr. Gina and I, anytime we need to or anytime we can accommodate it, we'll do a necropsy, which is an autopsy on an animal. And in both of the cases that we saw, and in every case that I have seen with these clinical signs, we see evidence of severe cardiopulmonary collapse with foam and pus filling the lungs. And I would say in most cases it's between 70 and 80% of the lung affected. So if you think about filling your lungs, they're designed so that we have, gas exchange, and it kind of requires most of that lung field. And so these donkeys basically are gurgling when they breathe, and you can hear those kind of crackles and wheezes in those lungs. Dr. Scott and I sent off a lot of cultures. We've looked at histopathology. We've tried high-dose steroids. We've tried a bunch of different antibiotics. And unfortunately, in these cases, we have prolonged death in some cases. We tried IV fluids. We've tried supportive care. And we don't have a definitive answer. And it's tough because it's not like all of these patients are happening at the same time. But we had 8 donkeys in this group, and we had to let 4 of them go already, and the other 4 all have similar clinical signs. So if my phone rings, I have a call out to a specialist at a reference laboratory. We're desperately trying to figure out what this is. And Dr. Gina made the comment this morning, if these were racehorses or valuable performance animals, we might have more signs. Or did you say that?
Yeah,
Tawnee said that. I'm sorry, I have a bad memory. We were all talking,
yeah.
and unfortunately, donkeys aren't performance animals, and people aren't willing to spend a lot on them. And every case is a little bit different. So we really would love to find out what this is so that we can treat it. We don't ever want animals to suffer. And this isn't a case where we can go, well, let's try all of these treatments, because once you get to a point where you're in respiratory distress, you are suffering. It is not appropriate to prolong life at all costs. But we're hoping that we can get some answers. This is either viral, bacterial, or fungal. It's one of those 3 big categories. I guess it could be autoimmune, but that would be weird to have groups. And it seems to be related to this area. Yeah. Horse Plus didn't see these cases in California, so if any veterinarians see this and want to offer us advice.
We'd love advice.
Yeah, it is pretty tough because you have to make calls on animals that you look at and you're like, this animal looks like it's going to be okay. And then I would say we have we've saved no cases that have developed these clinical signs. So it's pretty tough.
I mean, in the necropsies, usually you'd have this healthy pink tissue, and these lungs are just like dark and like they're dying, and it's rapid.
Yeah, there's necrosis.
So
too.
Yesterday, we're all loving on these donkeys. Like, they're eating treats, they're happy, and today they're all miserable. And because we've, have almost a decade of dealing with this and seeing these necropsies and stuff, we know that their lung tissue is dying at that point. And I think for me, it's probably one of the hardest ones we deal with, because it's like you take an x-ray and, there's severe arthritis. This is causing pain. Yeah. This is the right thing to do. For these donkeys, many of them are highly adoptable donkeys. And this disease just comes in and takes them, and they're gone. And it's like, it breaks me up inside, because it's like there's nothing we can do. And I'm sure for you all as veterinarians is really like.
Well, our mandate is do no harm. And sometimes that means, you never want to euthanize an animal that has a chance. But nothing to me feels like a failure of that oath, like finding your patient has passed overnight and not knowing if that animal suffered. Euthanasia is really difficult, and people always say, I could never do your job. Euthanasia is not the hard part of my job. It's animals suffering or not having that timing right. And it is. It breaks your heart, because this is not a 35-year-old animal. These animals are young. We really need to find out what this is.
Friendly and sweet.
We're trying.
It's so hard. But like the do no harm is, we're preventing that suffering. And that is, this is the hardest job on earth, I think, for the amount of animals that we see. And we have to rapidly make decisions. Like I said, there's no other organization out there doing this. So what you're seeing Horse Plus do ultimately could be replicated at other organizations to prevent more from going to slaughter. And that's the whole Full Circle Life Horse Shelter Network, and we're encouraging other organizations to do that. They don't have full-time vets like we have here, and this is a very unique situation here at Horse Plus, because we are able to rescue a large amount of animals. We see a lot, but we also have to say goodbye to these suffering animals that come to us, and it's hard. But we're hoping this debriefing will kind of give you a new aspect and look into what we do.
This is the next girl that was with that boy.
Is this me? This is another, we've already kind of explained what we're seeing. So we had another young Jenny, she was only 4, with very severe, her respiratory rate was in the upper 60s. So she was basically panting, and same set of clinical signs. I think Tawnee just mentioned other people don't do what we do. This disease happens so quickly that I think what likely is happening, if this is happening in owned donkeys, is that people are coming out and they're finding that their donkey has passed. And how many people are calling a vet and doing a necropsy? Right. And even if they did that, they don't have the history of acute respiratory distress, and they maybe only have one donkey, and maybe the other donkey doesn't get it. So when we look in the literature, usually when we have diseases, we have a consistent pattern. And we're seeing a pattern because we have such a high volume that I think is not being seen in the owned animal population. And that makes us unique. But if other people have seen the same thing in donkeys, we need help finding out. But yeah.
I know that there's a rescue that's within our network. She has 300 donkeys, and she gets from auctions. And one time she did get this, and she contacted me, and I was like, oh, I know what this is, but I don't know what it is. And I was able to tell her, like, keep that donkey completely separate. And I'm like, if it goes to your herd, you can lose all your donkeys overnight. And like, that's how dangerous this disease is. And thankfully she was able to keep it condensed, and she has a really good quarantine area. She's part of our Full Circle Life Horse Shelter Network now. But at the time when she got this donkey, she's like, I don't know what's going on. But this is a very dangerous, deadly disease for donkeys.
Yes, I'm trying to get the bottom of it. And then the next one is our little white guy that we have, our little albino-y looking jack donkey.
I named him Piglet.
Yeah, we fondly call him Piglet. He is in a stall right now because he did have elevated lung sounds yesterday and started coughing. But we were trying to give him a shot. We're like, maybe he has like heaves or COPD because he was in a stall coughing, but we're trying to be optimistic.
We get desperately optimistic. Yeah. And we're like, we want to save them so bad. Yeah. But in our heart, we know what it is.
Yeah. So
these 4 donkeys that are that we still have, they're showing these signs because it progresses so rapidly. Mm-hmm. We're doing an evaluation today, but we'll have to make a decision by the end of the day because if it's progressing, we know what it is.
Yeah, and we don't want to let him go into the weekend, potentially having to go into respiratory distress. So, yeah. So
he's super cute.
He is super cute. So we have him on our castration list. Hopefully it doesn't progress, but we're going to recheck him when we go up to quarantine.
I was up there earlier, and his breathing is not looking good. Yeah. And neither are the other donkeys. And that when we could throw treats into his mouth, he's standing in the corner, and he's coughing. I'm just like, oh, it's so hard.
This is next one's our next little Jenny donkey.
B24 305 is a 2-year-old Jenny.
She has scrapes all over her body.
She does. She's missing patches of hair. She's very sweet.
I'm just going to skip and do the donkeys.
Yeah.
Sure.
And some of the donkeys, I think we did all the things on yesterday.
Yes.
Yeah.
Two of them.
B24 307 was a 4-year-old Jack donkey. He had a severe heart murmur.
Yeah.
5 out of 6 heart murmur, and he had severely increased respiratory effort and increased lung sounds. And he received humane euthanasia yesterday.
And so that was the 5th euthanasia for the
Yeah, that was the
day.
last. And then B24 308 is a 3-year-old Jack donkey. Also has elevated respiratory rate and increased respiratory effort. But he wasn't as severe, and so we put him down for a recheck, but we are very concerned about him. And then B24 309 is a 1-year-old baby Jack donkey. He also had increased respiratory effort and respiratory noises yesterday. He also has scars and scabs all over his body, and some club hooves. Likes treats.
He does
Yes.
like treats.
So this is the heartbreaking aspect. I just jumped ahead because this group of donkeys.
They're all experiencing the same symptoms. So our team is up there currently doing the things for all these horses and stuff. So we don't have all the records for the other horses, but the other horses are young colts for the most part. I know there was one that does have an injured leg that we're a little concerned about, but overall that is what the remaining horses are, and they're currently getting looked over. But we had a little bit of a time to do a briefing.
We have one more
about
horse. Do you want
this,
us to
and
do
have
this one
one
really
more
quick?
horse, and-
Yes,
yeah.
it's the other halflinger cross boy who's about 22.
He is so cute.
He's very cute.
So cute.
He's very thin, but
I
I'm
think if I made a stuffed horse, like
That's what it would look like.
like a little plushy horse,
Yeah.
it would be him. Like,
he is
just-
super cute and very
adorable.
sweet. So we're hoping to do a sedated dental on him and hopefully get some weight back on him if all of his teeth look okay, and maybe some wither rads because he had some elicited pain over those areas, but it could just be he was ridden or worked and sore, so we just need to get
Give
some
him some
rads on him.
time.
Yeah. So he got all the things. So he got his microchip, his rabies, 5-way strangles, and he was dewormed yesterday, and he was a very good boy.
And in next week's episode, you'll be able to watch. Here.
Sure.
You'll be able to watch the intake, and so like the horses got to go out in the 10-acre pasture last night, which is another thing I hold hard and dear to my heart of like, yay, watching them go out there. And even like, you know, these wonderful ladies have said, like, just because they're in the 10-acre pasture doesn't mean that they're going to be adoptable, but it means that they're healthy enough to go enjoy themselves as horses. And that is just a nice thing that we're able to have that pasture to turn them out on, and they can enjoy being horses, and we can keep them comfortable and things. So the rest of the team are intaking the remaining horses that we don't have vet notes on yet. But just want to thank you so much for your support. Please give us feedback if you would like buyout debriefings in the future, and also consider making a donation to us. Like, these rescue missions are huge. They're very, very costly, and nobody else out there in the horse welfare industry is doing anything like what we're doing here, and it takes a lot of support, but we are putting a huge emphasis on raising awareness about slaughter, and that will help end slaughter. So please share this video and talk about the work we do here at Horse Plus. So thank you for watching.